This is my 6th AGM, and I'm going to do something a little bit different because I get a mixed reception to showing lots of slides, and so today I'm not going to show any slides at all. And as I do before I speak at things like this, I try and consult with my 15-year-old daughter, and I said to her, I'm not going to show any slides, I'm going to try and do something that's a little bit more interesting. She said, and I said, do you have any suggestions about how I might make it more interesting? She said, no, everything you say is interesting. She did, and I felt pretty good about that until she walked away and she said, unfortunately, only to you. So she was no help whatsoever. But I hope at least having those slides is going to help a little bit. Of course, there are a lot of people to welcome. I would like to formally welcome the board members who are here. Rob, of course, Natasha Stocker-Spoyer, John Dowling, who was re-elected earlier, Jane Thomason, new member, Mike Toole, of course, who's on the board as well. I'm not sure if Henry is here. He's on my list. He's going to be here, but he is not. Have I missed any board members? Sorry if I have. Anyway, welcome to you all. My own welcome to Alison Kitchen from KPMG. Thank you very much for coming. To George Raitt, too, from Piper Alderman. To Ian, of course, Ian Gust, our founding director. And to others who also help in a voluntary capacity, like our board members who don't sit on the board. And two of them here today, one who just walked in, Chloe Bryce-Short. Welcome, Chloe. And Ben Cowan, who may not have made it yet, but was planning to be here, who help out on our subcommittees, in both of their cases on our engagement committee. And we're really grateful for that extended family that does things for the Burnet. So welcome to you all, to our staff, of course, and students, to a group who are not here, but who has watched and hear this later, and that's our overseas staff. Burnet has, of course, permanent offices in different countries in our region, and of course those staff, 100 or 150 sometimes staff, don't get to come to these events, and but they do pay attention very closely to what goes on. So welcome to you all when you get to see or hear of this. To visitors and supporters, to our colleagues from AMREP, who's part of the broader campus that we're on, to those who donate to the Institute, particularly to governments, both state and federal, who are represented, where the mainstay of support for the Institute is obtained from, but also to those who represent many others who commit particularly to trusts and foundations throughout Australia and overseas, and of course to many individuals and the individual donors who are here today, and we really greatly appreciate your support. So thank you all for coming and to hear just a little bit from me about what's happened in the last year. I'm not at all going to be comprehensive, so I apologise if I leave out big chunks, but I've just arranged it into a few sections that I think we've focused very hard on in the last 12 months. And the first is, I think, continuing to reorganise ourselves in every way, not just in the way we have our operational centres, but in every way around our mission to achieve better health for poor and vulnerable communities in Australia and overseas, particularly in our region. And to do that through a combination of research, education and public health. And they're very deliberate words. And, you know, our mission is probably relatively self-evident, but there's another sort of single driver behind that mission, and is a major reason why you're all here with your staff, students and supporters. And it's really the major reason why there has been so much suffering in the world in the last 100 years or so, and it's because of inequity. That's really the reason Burnet exists, to address, in the area of health at least, inequity. You know, it's actually inequity that's killed more people in the last 40 years than anything else, certainly than all the wars put together. Around 320 million people have died since the Cold War, for example. And it's mostly through starvation or through preventable diseases of the sort that we all know too well in the Institute. So what motivates us is, of course, that fact and the realisation that the sort of things that we do and those like us throughout the world make a big difference. It's not a hopeless situation. Things do turn around. It's a major reason why over the last 40 years we've moved from having 40% of the world living in extreme poverty, which is a definition around, to 15% of the world today. That's not the economy that's done that. It's aid and innovation in aid. It's vaccines, it's better seed varieties, it's water, sanitation, hygiene, and the delivery of those tools to those who need it most. It's seen major turnarounds, for example, in under 5 mortality and in life expectancy. And it's understanding that it's the delivery of health interventions to the poor and of innovating in that space that is what's making a tremendous difference. The economy comes later and helps people move into the middle class and beyond. But that's a key reason why we're all here, for people in our own population and those throughout the world. And it's the core motivator. And as we've grown as an organisation, we've galvanised ourselves, as I said at the beginning, around that mission, around that core value, no matter what part of the organisation we're in. So when you see reforms, for example, such as the introduction of our health themes over the last few years and the appointment of principals, and you'll see in this report, it's a financial report for the last year, but it has some information on how we went in the last year in our activities. You see it's organised, first and foremost, into our themes. They're not our operational centres. They're a change we made to ensure that we had a whole-of-institute approach to core issues such as maternal and child health, sexual and reproductive health, and so on. And there are many other such innovations that have happened to our executive, to the appointment of deputy directors, associate directors, to the changes we've made to laboratory programs, and the new leadership team that we have that is a mixture of young and emerging leaders and very experienced people. Many changes over the last year or two in this regard, with that achieving that mission and providing energy and drive behind that. And it isn't, as I say, just in those operations, but across the makeup of our board and of our administrative team and what our communications and fundraising groups are doing. So they're sort of the reforms that are always going on. They're the weekly conversations that our executive has, and that the 2 monthly conversations that our board has. And so significant reform is driven, most of the reform we have is driven by that. Of course, this, as I've already mentioned, is a financial report. And the Institute, as today's formal proceedings, I guess, make very clear, isn't just a feel-good place. Of course, it does good stuff. It's a company. It's a not-for-profit company, but it's a company that has a formal way of operating. And we think that's a very good model, good and very accountable model. But all the same, it means that we have all the same regulatory framework, all the same liabilities for directors and so on that any other company has, even though they're volunteers and it's a not-for-profit organisation. So that's where the rigour and the strictness in process comes in. So how did we do as a business in the last year? Of course, our aim is not to make a profit. We aim to break even. We obviously need to stay in business, but we want to spend everything we get on doing good works. So that's the fine line that we tread. Rob has already pointed out that the environment is a tough one for traditional sources of funding. But even recognising that, we still generated income of around $43 million for 2012, and that's a lot of funding for the poor and vulnerable communities in our midst. And we did break even. In fact, if you remove the sort of non-cash items such as depreciation, made a small profit in 2012, which was really a terrific result given that tough external environment that saw our total turnover drop a bit. And there's really a tremendous number of people to thank for that. It's not easy to achieve that result in this environment. But once again, I'd really like to thank firstly the executive team here, the administrative team led by Jeff, but particularly the finance team led by Peter. Neither of them have an easy job in achieving that. The oversight of the board audit committee of Ross and Mary Waldron, in particular Ross Cook and Mary Waldron, and others who sit on that and attend that committee, do an awful lot of work to keep things on track. I really appreciate their efforts and advice. Of course, to our auditors, KPMG, keep us on track, also give us lots of advice, and many others that help us operate effectively within our limits, because that's how we have to do it. I also, the net effect of anything we do, any change we have to make to live within our means, affects everybody. And so I'm very grateful to the leadership team within the Institute, the executive, particularly the centre heads, and of course the staff underneath them who have really embraced the circumstance we're in, I've certainly felt, and made it work and made sure that we have achieved this financial result and are still going forward strongly as and culturally as the Institute that we are. So I'd like to say thanks, a special thank you to everybody who's helped achieve what was a really terrific financial result given the circumstances. What about what we achieved in the science and public health activities, the business the reason we're actually here? They're also detailed in, not detailed actually, just outlined, and I could never detail in just a couple of minutes what it is that we've done, and particularly difficult to measure. Those of you who know me, I do like to measure outputs, and yet it's not always easy to put objective measures on how we do in our science and how we do in our public health. But in some areas you can do it, and in our research, Burnet has this spectrum of activities from basic research to find out, new ways, new understandings that are going to inform policy and practice, and develop new products. And Rob mentioned the CD4 test, and then those new policies, practice, and products we hope go into public health practice that we're very much involved in a way that we hope also generates new knowledge and information and closes that loop. Hard to measure all of those, but in peer-reviewed publications we can. These are the primary currency of any research organisation, and working out how well you're doing can be done by just counting them. And as a start, we had 182 peer-reviewed publications in 2012, which is 14% more than we've ever had before. So despite the difficulties that I've just outlined, that's a tremendous result. And that's something for which everybody needs to be incredibly proud. It's of course the quality of that research that matters even more. One of the ways to measure quality of research is to look at the number of times other scientists cite that work in their peer-reviewed papers. And it's pleasing to see that our citation index, that is this institute's papers, in the last 2 years have continued to increase their citation rates and are now being cited at twice the rate that they were 5 years ago. So that's, again, a great credit. It's not just about increasing numbers, it's about doing things that are more meaningful, that others see as more meaningful and therefore refer to in their own publications. So I think on the science front, we continue to go forward really, really strongly. Rob's already mentioned translational activity, and at our core, as Ian pointed out in his quote 27 years ago or so, this is a translational institute. We're interested in being, at the research end of the spectrum that's a bit closer to directly and in the near term making a difference, whether it be through a new test or a new policy or a new practice. And we're just being incredibly active in that area, as Rob mentioned, with every point-of-care tests, vaccines, particularly the hepatitis C vaccine, policies such as, or research that is pretty close to it, such as the injecting drug work that Rob referred to, has been in the news in the last week from Centre for Population Health team, Paul Dietz and his colleagues. And of course a huge plethora of stuff from our international health programs that is very much in that category of research that is leading to more immediate changes to the way we can do interventions to better help people. And of course, our direct public health involvement is as much as ever. Our turnover in international health is pretty close to as high as ever, and so we're doing an enormous amount of work in our priority countries, which is Burma and PNG, to a lesser but very committed extent in Laos and in China, particularly in Tibet, and in other countries too, but in those particular places we have a sense of permanence, building activity again in Zimbabwe as we used to be in, and potentially a more permanent presence there as well. And what's really impressive isn't just the volume of activity occurring in our international health programs, but the degree to which our international health officers have really embraced this move that the theme leaders and principles represent of broadening the base, broadening the capacity of our overseas officers to do research through to public health practice. But mostly they're very involved in not so much delivering an intervention, but in building the capacity of a community or a group or a country or a government to do that job. That's what we really do overseas. It isn't a band-aid. It's activities that leave a permanent mark on those communities, a permanent capacity to do things better. Sometimes in response to emergencies, such as a cyclone or a flood, but more often as part of countries emerge from extreme poverty into a more developing and developed type group, as many countries in our communities, as many countries in our region are doing. So, from the point of view of our activities, it's actually been a record year. Our output and the recognition for that output in any way that you can or would like to measure has been just tremendous in the last 12 months. And when one factors in, and it's not our highest turnover year, it's still up there, but it's not our highest turnover year, that's a really remarkable achievement, and congratulations to everybody in the Institute for their role in that. And I'll just end with, because I haven't by any means comprehensively gone through the list of things we're doing, I want to just point out one Institute initiative as an example, a really important example of the direction in which we're going. And it's the Healthy Mothers, Healthy Babies program in PNG. This is a program that's emerged in response to the incredible maternal and newborn first 24 hours of life mortality and morbidity statistics for that particular country, and of our own government through AusAid's tremendously positive response to doing something about that. We at the Burnet see that we have a special role to play in the response to this emergency in PNG, and that's by adding a knowledge gain aspect to intervention programs. And it's because we don't really know necessarily what the right and best way to deliver interventions into poor and remote communities is. Interventions, for example, to reduce death during childbirth. In a perfect world, you'd have mothers find their way to decent obstetric care, and we very much push, even in PNG, for ways to have that happen. But in a country that health expenditure is still only 1%, what it is here per person per year, $40 per person per year in PNG, we spend $4,000 per person per year here in Australia. It's not realistic. It's just not realistic. Not in the immediate term. So what do you do in a village setting to greatly reduce the risks to the newborn baby or to the mother? And there are things you can do, but in most instances, we're not sure what works. You have to trial them. You have to trial them in different circumstances and different cultural settings. And this is where Healthy Mothers, Healthy Babies is going. Sometimes involves trialling new technologies, such as point-of-care testing. That obviously looks really good, working in a laboratory in a Western setting. What's going to happen when you use it in a village setting? 37 degrees, humid, non-experts using the test. Will it work? Will it deliver reliable results? You've got to do that research. You can't make that assumption. And that's what Healthy Babies, Healthy Mothers, Healthy Babies program is about in PNG. Augmenting a really important augmentation of a lot of aid that's going quite appropriately into PNG for that purpose. And for us, I'm particularly proud of it because it involves the entire institute. It's across all the centres, and you know, it's coordinated by a team that involves that doesn't know any centre boundaries, and we're going to see a lot more activity of that form in the years to come. So that's sort of the year past. What about the year ahead? I agree with Rob that that this is, in many respects, a great time for the Institute. You know, we do and can look forward to a very positive time. I think we're very unified in why it is we're here and what we're trying to achieve, and I think have a clear sense of how it is we're going to go about that. And I've just given one example that illustrates that. Clearly, though, challenges remain. The external environment is, of course, very difficult, both at a federal and a state level, who have been our core funders for the 27 years of our existence. I think it is challenging, but I certainly don't see doom and gloom. I see a lot of positive, even in the last week, from both the federal government and certainly the noises also that the coalition are making in maintaining funding in areas that the groundwork had really been done to not do that, and yet their minds were changed. And I think there's a really good recognition of the value of medical research, and particularly of our space of global health research. You know, the aid budget is increasing. It's under pressure all the time. It's actually increasing in a bipartisan way. And that commitment is there. Unfortunately, it's been delayed a little bit, but that commitment is still there. I'm very confident that that will reach moving from 0.35 to 0.5% of gross national income in the next few years in what we spend on aid. That's not a doom and gloom environment. It's important that that gets spent effectively and involves organisations like us doing research that is helping better target interventions, ensure that that money is spent as effectively as it can be. But it's a positive circumstance. Our own state government is having to respond to what other states are doing. New South Wales just dramatically increased their funding for medical research institutes. Victoria can't sit by and let that continue, and I don't believe they will. So for me, it's not doom and gloom. It is, from a government point of view, a time to tread very carefully and to make sure we are conscious of living within our means. But I do think there's positive signs on the horizon. No doubt, though, we have to continue to look for other models. We have to continue to explore other ways in which we can grow our business. It isn't about surviving. It's about how do we grow to do much more, to be more vigorous in promoting our cause and our mission. That's the challenge for the Burnet, and we need to do that. It's tremendous to have the increase in private donor support, the interest in corporate support. We've got to translate that. Australia as a medical research sector, not just ourselves at the Burnet, but I think that's going to come too, as it's come in the US and to some extent in the UK, and will come here as well. Certainly we as the Burnet are very active in these areas, not just for the Institute, but also for medical research more generally. So I'm actually pretty buoyant about the future, not starry-eyed. I certainly know that there are challenges, but I'm buoyant about the time ahead for all the reasons that I've mentioned. So, channeling my daughter and realising that I've gone on way too long, I'd really just like to say thank you again to everybody who's delivered such a great result in 2012, particularly to the administrative staff, who I do say at every staff meeting and every opportunity I get to speak. It's perhaps not so surprising to have a committed public health and research staff. They're here because they have a vocation in this area. What's been wonderful to experience in the 5 and a bit years that I've been here is that our administrative staff share just that same passion, commitment. And so really grateful to you all right across the board for the work that you do and sharing the results equally with everybody else. To my own executive team, to Deputy Directors, David, who unfortunately isn't here, to Mike, to our Associate Directors of Suzanne Crowe and Margaret Hellard, and to the Centre Heads, James Beeson, Margaret as well, again plays that role, Stanley Luchters, Robert Power. Thank you all very, very much for the wise counsel and the often delivering hard messages or innovating in a difficult environment. I really appreciate the work that you've all done, and the younger, emerging leaders, Paul Gorry, Heidi Drummer, and Paul Dietz, who are also making a big difference to how we operate. Finally, to people who are closest to me in a daily sense, to Andrea Eakins, my PA. Thank you, Andrea. You really do make my job a lot easier, and it's a great pleasure working with you. Unfortunately, Andrea's not in the room right at the moment. She is a treasure to this institute. And finally, to my own lab, who are often very much forgotten about, and I do apologise for spending so little time in and amongst the group that actually I'm most passionate about. So thank you to all of you for all your hard work, particularly to Paul Gilson, who heads the group with me, and who really allows me to have that special piece of and joy and interest in my life continuing, which otherwise would be too hard. Thank you very much.